Hi, my name is Dr. Eric Miller with Chiro-Med Health and Wellness Centers in Orland Park, Illinois. We're going to talk about the treatment of intervertebral disc disorders today. Disc bulges, disc herniations, disc prolapse, even disc degeneration. I'm going to use my assistant, Lauren Skarupa, to demonstrate some exercises and also the possible treatments such as manipulation and flexion-distraction, also known as decompression, that could be beneficial for disc problems. So typically what we do is we do a complete evaluation, including history, examination, x-ray, to determine an exact diagnosis. Is it a joint problem? Is it a muscle problem? Is it an actual disc issue? What exactly is causing your lower back pain? Is there a nerve pinch involved with this situation, or is it just spinal pain? We're going to use this particular sample case as a patient that has lower back pain with pain going down the leg, such as sciatica, coming about as a result of a disc bulge or herniation at about the L5-S1 area. After complete examination, we found that there is a disc problem there, and we're going to demonstrate exactly what we can do about that to help to decompress the disc a little bit and take some pressure off the nerve. The first thing we do is basically palpation. So when the patient comes in, we need to put the hands on them after doing the complete examination, including complete ranges of motion, and determining which particular ranges are causing exacerbation of pain, are causing the pain to radiate more. We want to stay away from those particular movements because that's where the pinch is happening at. If you bend forward and it sends pain down the leg, you're going to want to not do that until the inflammation is better controlled, to where you can do that without eliciting pain that goes away. What we try to do is called centralization of pain. So we want the pain to go back to where it actually is starting from. That's called centralization. Whenever the pain is shooting or radiating farther away, that's not a good thing. That means you're pinching or provoking the nerve. We don't want to do that. We want to try and get away from anything that's provoking the nerve, try to get to where it's centralizing back to where it came from. So usually the examination is going to determine exactly what provokes those symptoms, what causes it to either go down the leg if it's a lower back disc, or go down the arm if it's a neck disc issue, and stay away from that. When the patient is having pain that's coming about as a result of a disc problem, such as a herniation or a bulge, they're generally going to have restricted ranges of motion. They're going to have muscular spasm in the area to try to protect that particular area. So doing the palpation to find out or to address the muscular component of it is a real good place to start in the treatment process. So we're basically just going to kind of check things out and see what's tight and what's not tight. And in general, if there's an L5-S1 disc bulge or herniation, you're going to find some tension through the lumbar paraspinal muscles or the erector spinae muscles. When we find that, it's good to address those muscles by doing some massage work or stretching to loosen it up. We also want to look at the vertebrae and find out if there's what kind of rotation or lateral bend misalignment there is that's associated with the lumbar disc. Let me have you lie on your stomach for me. Usually patients that have lumbar disc problems in the L5-S1 area, they can come in with some swelling in that particular area. They can come in with restriction of the vertebrae as far as movement patterns, and they can also have muscular spasm around that area. So it's good to address that. The best way to address movement issues is with manipulation. I'm going to do a demonstration of a lumbar adjustment that will show you how to free that particular area. Now, when you've got a disc problem there, you don't want to do a lot of rotation. You don't want to do anything that's going to provoke the symptoms. So when you get the patient into position for the adjustment, if they're already complaining of pain going down the leg more so, you're going to want to kind of step back and reassess and see if you can do it in a different position that won't elicit those symptoms. Let me have you turn over to your side first with this side out. This is just going to demonstrate a general lower back adjustment. If there's a problem with L5 on S1 and that disc is bulging because of the abnormal wear and tear over time, it's good to get that particular area released. So we're just going to lean into it, give you a little adjustment just like that, and then let me have you lay on your back for me. That was real simple. You don't want to go too crazy with the manipulations when there is disc pathology present. You don't want to get a real hard adjustment. You want to get it nice and soft so that it moves, but it doesn't provoke the disc tear at all. The next thing we're going to do is general stretches for the glutes. So this is an assisted stretch. It'll stretch lower back, glute, and hip. When sciatica is present, a lot of times the hamstrings and calf muscles will get tight as well, so it's really good to stretch those in addition to. For video purposes, I'm not going to go through all the stretches because it'll take a long time. But this is a great stretch. When you're treating disc problems, you've got to decide which particular motion is going to be the less painful. This is called McKenzie protocol, and you've got to find out if flexion or bending forward will provoke the symptoms or make the symptoms get worse down the leg, or if extension is going to provoke the symptoms or make it go worse down the leg. And we're going to do exercises that won't provoke. So I'm going to demonstrate Williams flexion exercises first. Generally, this is one of the first stretches you could do at home or assisted with the patient to help to open up the holes where the nerves come out behind the disc and create a little bit of negative vacuum in the disc to suck the disc material back towards the center. So I'm going to have Lauren demonstrate Williams flexion exercise. Let me have you bring this one down first. So we'll start you off actually like this. How's this look, Doc? Were you in a good position? Yep. Maybe you can go around that way so you can see what's going on. There you go, good. So you start out with the knees basically at 90-degree angles. Then we're going to have the patient bring one knee up and hold it to their chest, flattening the lower back into the table and kind of tuck in the pelvis to make sure that you're getting as much flexion through the lumbar spine as you can. They're going to hold that for about 10 seconds. When they're done with that, you're going to go back to this position, hold for about 3 seconds, let that rest, then go to the opposite leg and do the same thing. So we're going to bring that knee up to the chest as much as we can, make sure that lower back is nice and straight on the table or on the floor if you happen to be doing it on the floor. Hold that for about 8 seconds, bring it back to this. Now you can repeat this 5 times on each side and hold it for about 10 seconds. The next step in the Williams flexion exercises is the double leg. So we're going to bring both legs up to the chest, press them firmly to the chest, and flatten the back to the floor or the table, whatever you're on. Hold that for about 10 seconds. Let it go back to a neutral position. Let that rest for about 5 seconds, and then repeat. Hold for 10 seconds, and then go back to a neutral position. You can do that 5 times. That's basically going to flex the spine enough to allow the disc to be pulled more towards the center. And it's good just to stretch that lower back as well. If the patient is not getting any radicular symptoms with extension, then we'll go into McKenzie exercises, which is extension exercises. Let me have you turn over onto your stomach. The purpose for doing McKenzie extension exercises is to extend the spine to create a traction through the disc to hopefully suck that disc material more towards center. So you're trying to create a negative vacuum on the inside of the disc by extending. Now the thing that you really need to watch out for is to make sure you're not pinching the nerve when you're extending or irritating the joints when you're extending. So if the patient is feeling pain going down the leg more so, discontinue and go back to the flexion exercises. You want the pain to centralize a little bit, so you've got to find out, is this just pain that's more of an achy pain or is it a sharp pain? Stay away from sharp pain. If it's dull, achy pain, that's pain that you're going to have to kind of go through because the area needs to be remodeled a little bit. The soft tissue in the area needs to be remodeled or restructured. Let me demonstrate the extension move. The first thing you have to do is the patient needs to come up into a position where they're up onto their elbows. And they just hold that for about 10 seconds. Again, if they're feeling pain going down the leg, you need to discontinue. If the pain's coming from the leg into the low back, that's called centralization of pain. That's what we want. Go ahead and drop back down onto your tummy. And then do it one more time. Hold that for about 8 seconds. And again, hopefully the pain is coming out of the leg and returning back to the L5S1 area. And then go right back down. The next step to this is to actually have the patient do a complete push-up while keeping the pelvis on the table or on the floor. I'll give you all the way. So this is about as much extension as you can get, and that's really going to pull on that disc quite a bit. And hold that for about 5 to 8 seconds. Go ahead and drop down. Let that decompress for a second. And then back up again. And again, 5 to 8 seconds. And good. Okay, so we've demonstrated manipulation, some stretching, Williams and McKenzie exercises. Another great thing for discs is flexion distraction or decompression. So we're going to go to a different room and I'm going to show you that. Come on. This technique is called flexion distraction. Again, this is a way to traction the disc or decompress the disc to hopefully centralize the disc material more towards the middle of the disc and opens up the IVFs to the back of the disc to take pressure off the nerves. So the purpose of this is basically to flex the spine while I put pressure above the bad area. So what I'm going to do during this is I'm going to actually put my hand right about L5 vertebrae, and then the patient's cuffed at the ankles so that we can get a good traction, and then I'll push their lower half down while stabilizing the lumbar spine. So you push it down about 2 inches, keep the pressure on the lower back, and then that stretches out the disc. And another time. Depending on the patient and what side the disc happens to be at, you might grab one side versus the other. And again, keep in constant communication with the patient to let them tell us what makes it feel better versus anytime that it gets worse is very important. Okay, that's it. That was a good demonstration of how to treat disc problems properly. Again, most of it's assessment, making sure that you have the proper diagnosis, that you don't compress the nerve more, that you decompress the nerve, and hopefully centralize the pain more towards where it began and let the healing process begin. If you have any questions about how to treat discs or you have any back pain issues, feel free to call us at 708-403-2727. Nice talking to you.